Hello parents, welcome to GenX Parenting. April is Autism Awareness and Acceptance Month. With one child every 58 children in the age group less than 10 years in India getting diagnosed as autistic, it is an important issue that needs to be discussed. But in addition to that, the ignorance associated with it, the taboo that this disease has, and the delayed detection are causing the bigger problems in diagnosis and treatment. Today, we have with us an expert developmental pediatrician, Dr. Rajeshwari Ganesh, and she is going to tell us about what are the early signs and symptoms of an autistic child and what are the supportive techniques that parents can use to ensure that these children live a normal life. Welcome, ma'am, and thank you for giving us time today.
Thank you so much, Leena, for asking me to be a part of this much needed discussion. And
Okay.
I hope this will be a beneficial session for all parents.
I'm sure. So, ma'am, starting with our first question, that what exactly is autism in simple words, and are there any early indicators of autism that parents should take note of?
Right. So autism is actually, in very simple words, if I were to use, it is to be by yourself. So it means that you see these symptoms in a child, that the child will have trouble in communicating, may not find it easy to communicate basic needs, basic wants, and also may not be very open to interactions. So for example, when you call out to a child, or when you want to show something to a child, or when the child wants to show something to you, the child may not really know how to do this. So there is a difficulty in interaction. There is a difficulty in communication, wherein the child is not able to use words or use any gestures, any form of communication to indicate that the child wants something. And the child engages in repetitive behaviors, like lining up toys, or being fixated with certain things, like spinning the wheels of the car, or looking at spinning things, or fixations with some toys, or aversiveness to sounds, or so there may be some repetitive behaviors also happening. So this in a nutshell is autism. And the earliest indicators that parents can be mindful for, or watchful for, is actually responding to name call. So when you call out to your child, the child must start responding to his or her name, the earliest being at 8 to 9 months. So by 12 to 14 months, if the child is not responding to name, is not looking, what do we mean by respond? When you call out to a child, the child must look at you. The child must give you that connect, that, oh, you're calling out to me, and make an association. So that is the starting point of social interaction, or being interested in the other person. So this is often the earliest indicator. And then at 12 to 14 months, children use a lot of non-verbal modes of communication. So they may point, they may use gestures like pick me up, or they may point. Now, many times there's some confusion with pointing. Many parents seem to think that pointing is taking their hand to the object. That is not pointing. Pointing is when the child is standing where the child is, and the child sees a car on the showcase, and the child from various points like this with an index finger, and looks at the parent, like, like, look at me, I'm showing you something. Okay. So this is pointing. And also simultaneously, the child will start doing things like point to nose, point to eyes, point to head, right? Or point to pictures. Now, again, if the child takes your hand, takes the parent's hand and points to the nose or points to the picture, that is not pointing. Pointing is something that the child does himself or herself. Okay. So it is very important to understand this. And if responding to name call 8 on 10 times, see, all children, sometimes when they're engaged in something, they don't want to look at you, right? But if 8 on 10 times the child is not looking at you when you call out to the name, by 12 to 14 months, this should ring alarm bells in parents' minds and prompt them to seek for help. Similarly, By 18 months, if a child is just not pointing to body parts, pictures, on asking, like if you ask, where's your nose? The child has to point. Where's the dog in this picture, in this book? The child has to point. Or if the child wants something, the child has to, if not using a word like they or give, should at least point or use a gesture like this, they do, or no, or yes, So if the child is not doing any of these early pre-linguistic, we call these pre-linguistic milestones. Pre-linguistic means the milestones that come before language or words. So the child is not using this by 18 months, parents must uh, take note of this and ask for help. Right. Along with this also comes lack of eye contact. When you call out, child is not looking at you. Child may develop some aversions to sounds, like everyday sounds like pressure cooker, mixer. Child may be interested in looking at the fan, would rather look at the fan than look at you. Child would rather look at the wheels of the car or the wheels of a bicycle than look at you. So these sometimes are the earliest indicators that the development is not progressing, the social development is not progressing in the right way. Right. And then of course there are delays in words too, but before that, pointing, eye contact, not responding to name call are very, very important milestones that parents should be on the lookout for.
Okay, that was very important. So do you think, or as per your experience, can autism be cured with the treatment?
See, this is a question that many parents ask me, and I always tell them that all of us have some quirks, have some difficulties, have some strengths. So it is all about putting our best foot forward in life and in society. So what we know now is that if we learn the signs early and act on the signs early and don't get scared, we should not get scared. It is a developmental disorder, meaning we can help this, we can help minimize this disorder if we start early intervention. So if we do that, we are able to teach our children to put their best foot forward in society, mask their symptoms of autism, and engage in society in a way that they are accepted. So that is very important, that we must learn to recognize the signs early and must teach our children to communicate and be a part of society. That itself is more than enough actually in many situations.
So any simple exercise routine which you can recommend, or which you can, some basic techniques, not the detailed ones, right. basic techniques which could be helpful in improving the behaviors that you mentioned, like pointing at things or responding to name calling. So if right. you could show us those techniques, maybe parents can adapt to them and help their children better.
So the first thing that parents can do is eliminate any distractions at home. So the commonest distractions being TV and mobile phones. So by elimination, I'm saying that do not give unrestrained access to these gadgets to children, because there is no proof that these gadgets are causing autism, but then they will not look at you and when you're trying to play with them and engaging with them. Correct. So the first thing is minimize screen. The second thing is, when you're calling out to your child and your child is not looking 8 on 10 times, then you can either use something visual. So for example, you can get a toy and you can kind of show the toy to the child and then pair the toy with the child's name, so the child understands that there is a purpose for which the name is being called. Okay. And always be at the child's eye level. The child is only very, quite short and we are quite tall. So if we are going to stand and we're going to call out, maybe the child may not really know how to respond. So you have to go down to the child's level, sit in front of the child and then call out the name and show the toy. So we call this using visual cues in therapy. So when we do this, many times the child learns to respond to name call. The second thing is, the parent and the child must always sit face to face. Many times children will sit on their parents' laps and then the parent will try and teach them things, but this does not facilitate imitation. Imitation is you must see what is being done to imitate. So always sitting face to face at the child's eye level is a very, very good thing. You can use any corner of your house. You can use the floor, you can use a floor mat. And you can also use visual cues like putting a floor mat with, say, alphabets, letters, so that the child knows that this place is my playtime place or my play zone. And so the child always comes there and sits there because he or she knows that parents will play there. The third thing is that when you are telling your child, like, do you want something, and the child is not able to answer yes or no, give choices. So for example, do you want chapati or do you want rice? Do you want a ball or do you want bat? Chances are that the child may just reach out like this or pull your hand towards it. But what is important is that you must take your child's hand and make them point to the object that they want. So this facilitates the neurons in the brain which are not developing in the right direction, and helps the child learn imitation, which is the prerequisite for language, which is the prerequisite for communication and interaction. Hello, I'll be demonstrating some simple strategies that you can use at home with your child to facilitate play and imitation. So the first thing here is you have to eliminate all distractions which will not allow your child to engage with you. So choose a space like this which is away from distractions, namely TV and mobile phone. When you are interacting with your child, your cell phone or any other item that can distract you should also not be around. There should only be space between you and your child, and if possible, please do sit face to face like this, so that it gives the child an opportunity to look at you, to look at your expressions, to see how you're using your hands, to see what actions you're doing. The second thing is that if you choose some toys like this and sit in front of your child, and the child pulls your hand saying that the child wants this toy, this form of communication should not be encouraged. What you can do is you can take your child's hand and make the child point to the object that the child wants. While doing this also, you can use the word they, or give, so that the child understands that every time you are making the child point to the object, you're using the word they or give, which means to give, and the child is then in a space to imitate you, either the action or the word.
So coming to the next question, any perinatal factors that would be mom should be taking care of so that this disorder development can be avoided?
Right. So there is a lot of research happening on what are the exact causes of autism, but the perinatal factors that we can take care of is making sure that we take all our medications. So there are some independent risk factors, like there is a weak link that's saying that gestational diabetes mellitus could cause this, and prematurity, which again is because of, the mother's blood pressure is increased, or the blood sugar levels are not controlled, or the mother has severe anemia. These are all very high risk factors for preterm delivery, as in the child being born early, which is a risk factor for autism. So making sure that all the medications are taken on time, you go for your antenatal visits on time, eat well, eat a good nutritious meal, simple home cooked meals, and stay active and fit. And that is very, very important. And stay happy. Find things that make you happy, find things that make you feel joyful in life. It is a fantastic time in your life. You're carrying a new life, and so you should be very happy about it. But research is still on about what are the exact factors that are causing autism.
Okay. And lastly, ma'am, there are a lot of myths which are associated with autism, and I believe that is the most dangerous thing, because this, as they say, half knowledge is very dangerous. So this myths are actually preventing parents to approach the right experts for guidance. So what are those myths, and how parents should stay away from the same?
Right. So the commonest myths that we discuss with parents is, one is vaccines. Vaccines cause autism. There are innumerable studies conducted which have proven that vaccines and autism are not related. In fact, many of the symptoms that I told you, just mentioned to you, come at around the 12 to 14 months, and the MMR, the second vaccine, is given only at 18 months. So many of these symptoms have already started before the MMR vaccinations are completed. In fact, measles if the child contracts measles, can develop a very dangerous form of brain disease called encephalopathy, which can be fatal to the child. So measles is something that you wouldn't ever want your child to have. So MMR vaccines are very, very important. They must be given, and MMR vaccines do not cause autism. There is no link, there is no proof, scientific evidence. Similarly, another myth that is in vogue is thiomersal causing autism, but many of the vaccines that are now produced do not contain this thiomersal, and so that is also disproven. The third myth is boys speak late, or there is a history of late speaking in the family. But here we are not talking about speaking alone. We are talking about the fact that the child is not looking at you, the child is not responding to you, the child prefers to be in his own world or her own world, and the child is not using non-verbal communication as pointing and responding to name. So speaking, even before speaking, these symptoms, if missed, then the child will be diagnosed very late, and which can create more challenges for the child and family. So this myth also parents need to not pay attention to. Even if there is a history of late speaking in the family, they must visit an expert and ensure that the non-verbal communication and the interaction piece is in place, and it is just not a simple speech delay.
Okay. So, ma'am, if a parent wants to approach a developmental pediatrician for consultation of his or her daughter or son, then any preparation that you think the parent should undergo so that he or she is clear what needs to be asked?
Right. So there is parents can get videos of their children, because children have moods, so it makes things very clear. One or two videos of their child playing, of their child communicating. The second thing is parents can also download. There are many freely downloadable sites that are available online. MCHAT is one such tool which is widely used, and it is very, very good and very, very informative, and it at least will give guidance to parents about what are the things that their child is doing and the child is not doing. So then when they meet the developmental pediatrician, this screening tool becomes very, very helpful, because the developmental pediatrician can then explain to them that, okay, this is what this means, and this is what you have to do at home to ensure this, and this is why therapy is needed for this particular skill. So I would recommend that parents who are concerned about their child's social development do download the MCHAT and fill that, so it makes things easy for them.
Thank you so much for the information, ma'am. And the demonstration was really helpful. Autism is a developmental disorder. And if you think that any of your children are showing these kind of symptoms, do approach a developmental pediatrician at the earliest and get the consultation. Thank you so much. And if you find this video helpful, share your feedback in the comment section. And do not forget to subscribe GenX Parenting for more such informative videos.